We do have more of a timeline for when a vaccine will be rolled out here in Utah, but I want to temper everyone's expectations. We are still a long ways away from being able to take off the face masks forever and give copious amounts of hugs. Now, the Utah Department of Health today briefed us on this, outlining its plans with an eye to see the first vaccines start arriving in December or January. Now, first priority is going to be given to healthcare workers and hospitals that are directly dealing with COVID-19. Long-term care workers, residents, the elderly, higher risk professions, they could see it in February, maybe March. The general public is not expected to get it until summer of next year.
July is probably the most likely scenario. However, again, based on how much vaccine, all of Utahns could receive it in June, May, June, but I still feel confident about that all of Utahns could probably start receiving the vaccine in July timeframe.
Now, the Department of Health cautions that even as the vaccine starts rolling out, the virus is still with us. That means everyone will still need to wear face coverings, practice physical distancing, limiting gatherings, good hygiene, all the things we are supposed to be doing right now, at least until that vaccine is widely available by next summer. Back to you in studio.
Waiting for that vaccine, Ben. What's due to happen with the existing public health orders in the upcoming holidays?
Well, I just left a briefing that the Department of Health gave to lawmakers on the legislature's interim Health and Human Services Committee, and what we were told is that a lot of the mandates that are in place, the statewide face mask mandate, the limits on gatherings, cutting off bars at 10 p.m. from serving alcohol, all of those are expected to be extended beyond November 23rd. That's when the governor's current orders expire. Then we were told the restrictions, or the recommendations rather, for Thanksgiving and the holidays. And let's just go ahead and throw up a graphic for you all to see. The bottom line, the state health department and the governor are going to be recommending that you just do not gather with people who don't live in your own home. The risk of spread in Utah is that high right now. In fact, we were told the University of Utah Hospital over 100% capacity right now. If you want to have a family get together, they recommend doing it over a video chat instead. Now, they know some people are going to refuse to do that, so here's some tips to make it a little more safe. If you have sick or immunocompromised people, they should stay home, don't come. Everyone wears masks, even indoors. Make seating physically distant. Do not pass the plate. Have one person serve the food and prepare it masked. And if you can eat outdoors and physically distant, that is even better. Now, these recommendations are expected to be released tomorrow by Governor Gary Herbert at a news conference, and of course, we'll be tracking it then. Live on the Hill, Ben Winslow, Fox 13 News, Utah.